We already know what causes stroke. We know what clogs up blood vessels and the inflammation of the blood vessel line. We know how to significantly reduce breast cancer risk. We know how to reduce the diseases that are killing 9 out of 10 people in this country. We don't need to do more research. We need to get the word out.
Hey everyone, welcome to today's episode of the Beljanski Cancer Talk Show. Today we're honored to introduce Dr. Richard Powers, a true pioneer into integrative medicine and one of the leading forces in redefining what health and wellness look like. Dr. Richard Powers is an innovator in integrative medicine, putting together more than 2,000 hours of training with a lifetime of dedication into one forward leap in redefining health. With the founding of the renowned holistic centers and the penning of essential health guides on immunity, pain relief, and true wellness, he's considered the doctor's doctor, the one doctors go to when they need answers. Get ready to redefine wellness from the inside out.
Dr. Powers, thank you for being with us today. You are the medical director of the Intelligent Health Quarters. I love this name. Can you tell us what this is about?
Yeah, so I've been practicing for over 40 years. And for the last 5 years, I said, you know what? I want to help people more than just the ones that have a chance to sit across from me. And there's a lot of what I'm sharing that is applicable to anybody that's a human being with a body. And so I decided to create an online health learning resource. And Intelligent Health Quarters is my office version. My online website is Intelligent Health Now, so that's where people can go to learn.
So tell us more about the kind of practice that you are having and what people are learning on this website.
Yes, very exciting. It's about helping people understand that there's so much more they can do to be well and to get well if they're not, and to maintain their health and being and their vitality and their longevity and their health span. And it has everything to do with helping them understand what creates health and what sabotages it. Most people think, and I'll be talking about this today when it comes to breast cancer, that it's about good luck and bad genes, or bad luck and bad genes, that, or my family history has Alzheimer's, so I'm probably going to get it. And there's so much that we know that the research has told us, and my 40 years in practice has shown me, that can be done to slow, stop, and reverse these trends. And I want my mission and my vision now is to share this with as many people of the 8 billion people on the planet so that they can take more control of their health and rest more confidently when they go to bed at night.
Yeah, absolutely. And it's a message of hope because people are not doomed by what their genes heritage. They absolutely can either silence or trigger the activity of those genes by their lifetime. And that's why the education about that is so important. So what you are doing is really precious. You mentioned breast cancer. So your education is mostly towards women and breast cancer, or do you see all of
No,
patients?
I see all kind. But a couple of years ago, after I established the Intelligent Health online learning resource, and I wrote 3 books: Foundations for Creating Optimal Health, Optimizing Your Immunity, and Safe Pain Relief. Which was a couple of years ago, when I had all that done, again, to spread the word, to get it out, to make it accessible to people, because you can't just go online and Google this stuff. You'll get 1,000 different answers, and you won't be able to decipher fact from fiction from fallacy. But a couple of years ago, I said, you know what? I'm going to write a course that gets a little more in depth. And I went through lots of options about what topic. And then I thought, what irks me the most, or one of the things that irks me the most, is the whole thing around breast cancer. October is Breast Cancer Awareness Month. How come it's not Breast Cancer Prevention Month? There's so much, there's such a huge gap between what we know helps to significantly reduce a woman's risk of breast cancer and that which they're told, and that's what they're aware of. I set out on a course, no pun intended, to dig into the research. I planned it to take me 3 months, and 18 months later, I finished the course. much to my wife's chagrin. And it's really an amazing course. I'm happy to talk about some of the highlights of what people can learn in that course and why it's so valuable.
Of course, you mentioned prevention, and the conventional idea of prevention is sending women to have a mammogram every other year. What do you have to say about that?
A mammogram is a breast x-ray. So the concept is, hey, let's take breast x-rays to early detection of breast cancer, so that if we detect it early, then we can do something about it and have a more predictable, good outcome. And it's a great concept, but the research shows that it just didn't work out. And this has been going on for a long time. 10 years ago, this is the 10-year anniversary of a 25-year study of 90,000 women. So this is a long, big study. And half of the women got regular mammograms, half of the women did not. And they looked to see, okay, how many women died of breast cancer that got the mammograms and how many died that didn't? Because if this works, a lot less people would die of breast cancer if they got mammograms. And there was no difference. There was no difference in mortality. Only the people that got mammograms were oftentimes overdiagnosed. In other words, they said, oh, there might be something there on that x-ray. And they did biopsies and they did lumpectomies and all kinds of treatment that turned out to be unnecessary and harmful. So that's where I started with this research. I went, oh, mammography doesn't work, but we can't leave the women in the dark. There must be something that does. It's 2024. We must know something by now. And we do.
So we are dying to know.
Okay. So first of all, there isn't any one, even biopsy isn't 100%. You think I could take a tissue sample, you'll know yes or no. But even that has to be interpreted, the results. Because it isn't like normal cells, cancer cells. There's a continuum. So there's no one test that conclusively can tell you you have breast cancer and so forth. A breast thermogram it just measures heat radiations off of the breast. No trauma, no radiation, no harm, no pain, and it strongly correlates when there's abnormality. Now, most of the abnormalities on a breast thermogram are not breast cancer, but when you do have breast cancer and you have an aggressive form, it particularly is evident on a breast thermogram. And it doesn't matter if you have dense breasts or not, it works across the board, but it's not 100% conclusive, right? So now you add in a breast ultrasound. So now you get a breast ultrasound. You get a breast ultrasound is just sound waves, painless, harmless, and then you do a breast self exam. And there's a certain way to do that so that it's meaningful and you're not checking every 5 minutes and you're not misdiagnosing what you find. But if you do a breast self exam right, just like one, and then once a year, maybe every other year, depends on your age, depends on your risk, you get a breast thermogram and a breast sonogram, ultrasound. And if you see something that feels different and new in your breast, and you look at the breast thermogram and it shows something abnormal in that same area, and the sonogram is pointing also to something conspicuous and suspicious in that area, now we got a higher level of concern. But now you're still not running to a biopsy. Now you go get a breast MRI. And if it's available in your area, there's a certain type called a Prenuvo MRI. There's about 8 or 10 centers in the country in the United States. It doesn't require any contrast agents, highly accurate. Anyway, and then if the MRI say, yeah, we got some, now you go in and it's worse, puncturing and going in and getting a biopsy and confirming and knowing what type and so forth. So that's the sequence. You combine things, and how frequently you do it depends on your risk. The higher your risk, the more frequently you do it.
Yeah, and one would add that radiating every year or every other year and pressing a healthy breast is not good in the end. This can actually induce some trauma that will turn itself into the increased risk of
It
cancer.
absolutely does, and that's what the research shows. First of all, there's a certain subset of the women population that have genes. I'm not just talking about breast cancer, the BRCA genes and so forth, but they have certain genetic makeup that makes them more sensitive to radiation exposure. No one's screened for that, right? So everyone's and so the percentage, and it's a substantial percentage of the women that get breast cancer because they got mammograms and kept getting compressed and radiated, it's significant. And okay, look, maybe it's worth it if there's no other way, but there is another way, and it isn't harmful. There is no radiation, and you can avoid. Come on, we're getting mammograms to reduce our risk of dying of breast cancer, and there's a certain subset of the population that's increasing their risk by getting it.
I have chosen myself to go thermography a long time ago. Where I was disappointed a little bit is the explanation after that. Maybe in my case, there was not much to see and not much to explain, which was good news. But I felt it was a little bit of the technology is there, the reading is not always there. What do you recommend for people who feel that there is a little bit of letdown at the end after the thermography to understand all those red and blue and green colors?
Right. Yeah. So you could boil it down and say the red colors are the hotter, warmer areas, and the green are cooler. But every thermogram comes with a report, and the report gives you some indication about higher risk, average risk, low risk, about some concerning finding, right? But in and of itself is not diagnostic of breast cancer. You use that in conjunction with your self exam, use that in conjunction with your ultrasound, and ideally, you take that information and you have a doctor that has enough training to synthesize all that and say, okay, because this and this. Now, I know that a lot of doctors, both integrative physicians as well as conventionally trained doctors, they don't always know a lot about this stuff. They didn't do the 2 year deep dive like I did. So what I in my course, and again, I'm not trying to advertise my course. I'm just letting you know that I know this is what you're sharing is a good point. So I made up a document and I said, okay, this is how you figure out how often to get these tests and do your self breast exam. And then when you get your results, if you have a conventionally trained doctor, here's the page. Just hand it to them. This is what you do. If this is this, you do this. If it's this, then you do this. Then you check it, compare it to that. If it shows up this, you do this. If you have an integrative, more functionally medicine trained doctor, then I have a little different set of instructions. So I tried to think ahead and say, okay, look, if we're going to do something different than the standard conventional routine here, as far as monitoring and as far as prevention, then the instruction has to be really clear and laid out. So I made sure I did that.
You also mentioned the fact that some women, men of course, but women, could be susceptible, specifically susceptible to radiation more than the average, and that could induce
Mm-hmm.
cancer. How do you test for that? And who is doing that?
Yeah, no, I'm not aware of anyone that's doing that. And when I reviewed all the research, they didn't particularly mention, or perhaps I didn't read the 55 pages of that particular research study. So I'm unaware of the specific genes that are more radiosensitive. Clearly, if you have a BRCA gene 1 or 2, okay, so let's talk about that for a second. What that means, the BRCA1, BRCA, breast cancer, BRCA, that's what BRCA is. And there's two types. So BRCA1, BRCA2. These genes, everyone has these genes, and they actually protect us. They help. Our DNA is constantly getting bombarded and damaged, and we have the infinite wisdom that built our body, the intelligence, knows that was going to happen. So it built in a repair system. And so there's repair genes built in. And the breast cancer 1, breast cancer 2 are two of those repair genes. Tumor suppressor gene P53 is another one. There's
Mhm.
several of them. So it's all designed that there is going to be an insult to the genes. So if you have any of a mutation of, oh, by the way, if you have a BRCA gene, everyone has the BRCA gene. What they mean when someone has a BRCA gene, it means they have a gene mutation so that it doesn't repair and protect the DNA as efficiently. So you're more susceptible to injury, which means you're more susceptible for the cell to turn into a cancer cell, because a cancer cell is nothing more than the brains, the DNA, gets damaged and it starts taking on a whole new set of directions, which is what a cancer cell does. So the point is, we all have different types of weaknesses. Some have the BRCA gene, some have P53 mutations. We all have different weaknesses. It's the smartest path. And I originally started thinking, what can we do for these genes? What we can do is let's not trigger the genes that induce cancer. Those are called proto-oncogenes. We all have those, and they're necessary for normal physiology. But if those proto-oncogenes are damaged and they mutate, now they actually facilitate cancer growth. So let's not activate these oncogenes, and let's do whatever we can. We know what activates the tumor suppressor genes, these repair genes. And guess what it has to do that? Diet, exercise, sleep. There's certain supplements and certain botanicals, like in Wamabel, that helps to either support the tumor suppressor gene, activate those, or to inhibit the conversion of proto-oncogenes to these and turning them into cancer cells. Instead of looking for the individual genes, I say it's better, let's just do everything that we already know to help protect our genes so they don't turn into cancer cells. And one of the things would be, let's not radiate our breasts. Again, why do we need to? It doesn't decrease your risk of dying of breast cancer. So there's no upside, but there is a downside. So instead of trying to figure out, hey, am I one of those people? It just doesn't make sense, because there's alternate technologies when you combine that can really make a difference and help you know more about where do you stand as far as your breast health.
Absolutely, especially if you do that repetitively every other year. Absolutely.
Yes,
Because it's repeated injuries that in the end can break the way that destabilize the DNA, as my father was saying.
exactly. Double strand breaks, especially. Yeah.
Yeah. So you that's I see how you got more into prevention. So your course is more about understanding what to do to avoid cancer in the first place.
Exactly. And to avoid cancer and breast cancer, cancer in general, really, the only difference between breast cancer and cancer in general is breast cancer has a hormonal component. So if your hormones get out of balance, you get too much estrogen, it could fuel the estrogen hormone dependent breast cancers, which are 4 out of 5 people have that kind. But other than that, cancer is cancer. And so what you need to do is, one, you just want to do more things that protect your cells so you don't form them, and you want to do things that help your immune system identify and destroy cancer cells, because everyone has cancer cells. Everyone has cancer cells, and we have an intelligent system built into our bodies to in our part of our immune system to survey and look for these, and when they see it, they tell the natural killer cells, a certain type of lymphocyte, to kill them. So it's a beautiful system. The problem occurs when we have too much cancer being formed and our immune system is impaired. Now
Yeah.
the cat's out of the bag. The wolf gets into the hen house and it can proliferate. We don't have enough immune response to keep it in check. So the whole idea is, one, monitor your breast health and do it in a way that's not increasing your risk. Do it in a way that makes sense, like I described. And then if you see something suspicious, you know what? I think I see something suspicious on my sonogram and MRI. It doesn't mean you should cut off your breast. Maybe you get a biopsy at that point. It's step by step. Right now, if you see something suspicious on a mammogram, and God forbid you have a BRCA gene, they're going to say, listen, you're going to get breast cancer. You might already have it. Let's just take off your breasts and let's rip out your ovaries while we're at it. And I think that's way too far ahead of the game. It makes sense if you don't know anything else that you can do to reduce the risk. But if you look in the research, there's so much. We know that if you exercise the right way and regularly, and this is not like you have to be a marathon runner or an athlete, you reduce your risk of breast cancer 40% just with exercise. We haven't even talked about diet, an anti cancer mindset, and heart space, let alone the botanicals and nutraceuticals that are available that actually help the body identify and take down cancer cells, including cancer stem cells.
Absolutely. Do you want to say something about
I
that? And
do. I was hoping
what
you're.
is your recommendation for women and for men also with that?
Ever wondered about a supplement just for you? Introducing Wilma Bell, made for the unique health needs of women, the natural choice for everyday wellness. Our formula, carefully picked, deeply researched, for real results. Packed with the power of Pau Pereira, exclusive green teas, and Rawolfia extract. Every capsule is a step towards better health. Hear from those who felt the difference. Visit our website, masonbeljanski.com. Womabel. Feel the natural difference because you matter. Unveil the power of nature through Maison Beljanski, sourced from nature, perfected by science. Get 15% off your first purchase with code EP2. Feel better naturally.
Yeah.
Yes. In fact, right before I got on this podcast, I was sitting with a man that is going through chemotherapy and radiation therapy, and I'm co-caring with him and explaining to him that the chemotherapy and the radiation therapy can knock down the amount of cancer in the body, but it doesn't kill the stem cells, which is the cancer cells from which new cancer cells arise, which is why cancer recurs so often in so many people. If you don't do anything about what caused it, it's likely to recur. And part of what caused it is these cancer stem cells. The good news is there's things that you can do and supplements and botanicals, extracts that you can take. And your company makes Wamabel and Oncabel Pro, which contains botanicals that have been shown to knock down and kill cancer stem cells, as does certain extracts of pomegranate and curcumin. So so I recommend, you want to reduce your risk of breast cancer. There's diet and lifestyle pieces. There's the mindset and the heart space that's anti-cancer. And then here, take some supplements that are in the research shows that it reduces your risk even further, and include ones that kill the breast cancer stem cells. Because even if you can't get breast cancer unless you form breast cancer stem cells that then allow it to proliferate. So if you get on what I call a breast protect formula, and then you add, if you're at a high risk, you layer the Wamabel on top of that for sure, and now you're helping to keep it in check. You don't never. My theory is you never rely on supplements to do the work. You rely on your thinking, your diet, your lifestyle. You do the exercise. You learn how to eat in a way that is an anti-cancer diet, and it's really clear in the literature, and I've summarized it all in my course, all these pieces. And then you layer on top of that what we know are anti-cancer supplements, and that's why the name of my course is How to Significantly Reduce Your Breast Cancer Risk, regardless whether you have BRCA genes or you've had cancer before, breast cancer before. You can lower your risk. In fact, it's more important that you do these things if those are the case.
Yeah, indeed. The Beljanski Foundation has done some extensive research at Kansas University Medical Center with some botanicals and show that a number of them are able to inhibit the development of cancer stem cells, which is indeed something that chemotherapy or radiotherapy cannot do. For those who are listening to us today, this research, the publications can be found on the website of the foundation, beljanski.org. But doctor, I would like to understand. So if I am, for example, a woman concerned with my health, how can I benefit from your advice? Can anybody follow your course? Is it just for doctors? How does it go?
Yes. So I've written and have several courses and classes that I've created just for professionals to learn how to. In fact, one of my courses is called "What to Do Before, During, and After a Cancer Diagnosis for Your Patients." But 2 years ago, this I embarked on creating this course. This is for the 4 billion women on the planet that still have breasts, right? In fact, even if you don't have breasts because you were told you should have a mastectomy because you're going to get breast cancer and they did that, this course is even for them, because even if you don't have your breasts and you've had your hysterectomy and your ovaries removed because of this risk, okay, you can't go backwards, but you can go forward. And guess what? If you're ripe for breast cancer, you're ripe for any cancer, because again, all cancers share a lot of commonality as far as the cause: damage to the DNA, impaired immune system. And yeah, you can have certain genetic vulnerabilities, but those genetic vulnerabilities don't go away. And the BRCA1 and 2 is just about breast cancer. But everything that I recommend that's in my course to reduce your risk for breast cancer, it reduces your risk for all cancers. And because when we look at what's at the core of most chronic degenerative diseases, Alzheimer's and dementia, diabetes, heart attack, strokes, cardiovascular disease, autoimmunity, there's a lot of commonality to it, and it links back to diet, exercise, sleep, and stress and toxins. We've never been, we bathe toxins, chemicals, heavy metals, plastics, phthalates, they're everywhere. And I go over that in my course, and then I immediately say, but don't panic, because there's a way to reduce your exposure, and there's a gentle, safe way to slowly and gently promote the detoxification. So the course that I've created is really, even if a man did it, I talk a lot about breast cancer, but if a man followed my guidance, it would actually reduce their risk of prostate cancer and other forms of cancer. And if someone had ApoE4 homozygous alleles, which increases your risk for Alzheimer's and dementia, it would reduce their risk, because it's fundamentally given the body. I'm directing people. What does the research show, and what have I learned over 40 years? Predictably, provides the body with what it was designed to be given and treated, how you're supposed to live and think. How do you give the body more of what it wants and less of what it doesn't? I make that real obvious and real clear. So this course is, it's really for anybody, but obviously I targeted the 4 billion women on the planet, so they know how to take care of themselves to protect their breast health, significantly reduce their risk of breast cancer, but really to have it really helps improve the quality of their whole life and reduce their risks of all the disease. In America, when you take out auto accidents and car accidents and like that, right? And you're just looking at disease, 9 out of 10, this is from the National Institutes of Health, 9 out of 10 people in this country are going to die from a disease that's largely preventable. And my course outlines the guidelines to move you away from that fate, regardless of your genetics.
How do those women and men can access your course and get on board with this program?
They can go to intelligenthealthnow.com. So that's my mothership. And at the top is a banner that you could click a link, and you go and you can look at my little 18-minute free webinar that I cover more detail about what we're talking about today. And then at any moment, if they're ready and they want, they can click a button and they can access the course itself.
Can you give us the name of the books also that you have written?
Yes. So one's called The Foundations for Creating Optimal Health. So can you imagine what's in the foundations for creating optimal health? It's what 40 years of my life and research and caring for thousands of people. These are the most consistent dietary recommendations across the board that help create health and help avoid sabotaging it. And then I do exactly the same thing. There's not even a lot of explanation. It's more like the cheat sheet, the answers. Here's the diet: eat more of this, less of this. There's a little discussion about why. Primarily, I made this for my patients, and then I realized the whole world can benefit from this. So I made it into a book form. Same thing with sleep, how to get the most deep restorative sleep. There's certain things that interfere with it, certain things that support a good, deep, slow wave. When you're sleeping and you get some deep, slow sleep, slow wave sleep, When you wake up, if you had a good night's rest, nothing feels better. You could take on the world. But what's happening in your body is your brain and your body is detoxifying, healing and repairing. Your immune system's resetting, inflammation's being dampened. Everything is going, it's not resting. You're more metabolically active when you're sleeping. So I make sure people are clear about sleep, the exercise, the two main different categories of exercise, low intensity, high intensity. And the whole thing about diet, and I have a Q&A. So what about keto diet, and what about paleo, and what about this? I try and answer the questions that people may have. And I go over about toxins, what are the most common sources, and how do you reduce your exposure? And listen, I know I'm a human being. I've had thousands of patients. I do everything I'm espousing here. It's got to be practical. So I give people ways to do this and to implement these changes in a way that is doable and sustainable.
Yeah. That's very important because sometimes it can feel like
Oh,
overwhelming, especially when people are coming from another reality where they are not doing none of those things. I have heard a number of people, of course, who have long-term remission from cancer 20 years after the initial diagnosis. And they often tell me that their cancer diagnosis was a wake-up call, and actually they had a positive outlook on it looking back, saying, thanks to this cancer diagnosis, I went back to analyze everything I was doing, reevaluate my lifestyle, and then I learned so much. And now I live a life which is much more clean, much more satisfying, and much more meaningful. So
that
that's a very good school.
no, that's very huge. And I have a whole module. There's 9 modules in my course. I devote a whole module on an anti-cancer mindset and heart space. And a lot of what I took out of this book called Radical Remission. And these are people. This is this brilliant PhD. This woman that went and she dug in and looked at thousands of cases where people were given a terminal diagnosis, sent home to die. And then she looked which ones died, which ones didn't. And the ones that didn't die, what was common? What were the common threads among all of them? Because some things will be unique, but what's common? It's just like the same thing with the blue zones. It's a similar thing. Only this is people that were terminal cancer, sent home to die. They've had the chemo. It's hopeless. She writes a book. And so I put a lot of that and more in my optimizing your mindset. So it's about activating your immune system with a powerful why. Why should I live? Other than the fear of death and what's on the other side, who am I here for? What am I here for? These are, I'm giving you a quick lowdown of the things that were common of the people that survived, and following their intuition, taking control of their health, visualization, releasing suppressed emotion, forgiveness, grief, journaling their thoughts, communicating their feelings, increasing positive emotions, laughing, hugging, meditation, prayer, positive thoughts, uh, deepening their spiritual connection, however they did that, and embracing social support. These are some of the common threads, and I go over details and break it out, and I give little summary charts. But these are the areas, and what I suggested people do is they look through these things, and you say, what jumps out at you? It's the same thing with the diet, exercise, sleep sections. What jumps out at you when you see this? Like when I looked at this, when I was doing the research, forgiveness jumped out at me, forgiving myself. And then I thought, who else do I need to forgive? And I thought of some people. This is huge because the mind, there's a field called psychoneuroimmunology, and it's the impact of, and actually psychoneuroendocrine immunology. The hormone system, the immune system, and your brain, your thinker, is all connected. Far more than we ever knew. Far more than what I knew when I got out of school 44 years ago. Uh, but anyway, you can't affect one thing without affecting everything. That's the bad news. The good news, because it's so connected, these people didn't do it. Now, some of the people also, they made radical changes in their diet. They did that also. A lot of these people did that. And a lot of them also took certain supplements as well.
Yeah.
So they just didn't sit back and get positive, optimistic, and forgive some people. It was a multi pronged approach. But a lot of it had to do with right here. and right here.
Absolutely. And you want to change that. You want to turn your life around, your emotions around. You want to be healthier and happier, all that together. It's very actually difficult, I think, to do a third of the program without doing it all. And obviously, it's when you are doing it all that you get the results. I often end my presentations by saying, the supplements are going to give you time because they are going to work at the cellular level. But what are you going to do with this
Yes,
time?
yes.
And that's what really matters on the long term. And that's why educating people on how to turn their life better and cleaner and detox and give them a feeling that exercise is not just a course that they have to do to look good for other people, but they need to do that for themselves to reduce inflammation. The role of inflammation, all that is really paramount. And I see that what you are doing is changing the world one patient at a time, that you educate. And that's, thank you for doing that.
You're welcome, and you're doing it and you know exactly what you're doing and all the work and heartache and sacrifice you've done over the years and continue. And now I'm not satisfied helping patients one at a time. I want to get this into the hand. That's why I'm doing this podcast. I want to get this information in front of the 4 billion women of this planet. Okay, it's a big goal, but that's the point. It's like it reminds me. I'll end with this, unless you want to go on. But it reminds me when my mother had a stroke and then died a couple of years later. She had a stroke because she had a surgery to clear out her carotid artery because it was clogged up. And the doctor said, if we don't cut this open and clean this out, you have a 25% chance of having a stroke within 5 years. But meanwhile, she's diabetic and it got clogged up. She's at risk for a stroke, right? She had the surgery against my recommendation. And then she had a stroke from the surgery. And then my sister wanted to, she actually flew to Hawaii and ran a marathon to raise money to help get more research around stroke. We already know what causes stroke. We know what clogs up blood vessels and the inflammation of the blood vessel line. We know all that. We know how to significantly reduce breast cancer risk. We know how to reduce the diseases that are killing 9 out of 10 people in this country. What people don't know is what those answers are. We don't need to do more research. We need to get the word out. And that's what I'm passionate about. I think it's coming across.
Thank you for doing that. And I hope that this podcast will help promote everything you are doing.
Yep. And thank you. I appreciate the opportunity to be here.
Thank you. Thank you so much, Dr.
And
Powers.
thank you and your followers.
And thank you, everyone. This is the Beljanski Cancer Talk Show, and we'll catch you next time. Thank you.